Hi, I'm Joe Wolski. Today I'm going to talk about how we use computer modeling and simulation in an application at the NIH facilities in or near our main campus in Bethesda, Maryland. I'm the industrial engineering team lead with the Office of Quality Management, Office of Research Services at the NIH. Our office serves as internal consultants for the Office of Research Services. In addition to the variety of quality management and industrial engineering techniques that we use, we have applied computer modeling and simulation in a variety of projects over the years. The co-authors on this paper are my director in the Office of Quality Management, Antonio Rodriguez, and staff from our support contractor, MOSIMTEC LLC, Nate Ivy and Yuski Lagarde. For those of you who are not familiar with the NIH, we are the steward of medical and behavioral research for the nation. We are a federal agency that is part of the U.S. Department of Health and Human Services. The mission of the NIH is science in pursuit of fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to extend healthy life and reduce the burden of illness and disability. Much of this fundamental research occurs in the NIH Intramural Research Program on our main campus, located in Bethesda, Maryland, and several satellite campuses in surrounding Montgomery County, Maryland, in the immediate suburbs of Washington, D.C. Pre-COVID, our main campus sees about 40,000 employees, contractors, visitors, and patients each day, and operates like a university campus or even a small city. So once people arrive at campus by personal vehicle or regional public transportation, transportation throughout the main campus and our satellite campuses is provided by a shuttle system utilizing vehicles like you see here. The system operates throughout a fixed number of stops and fixed timetable, and the map you see here is an example of one of those routes throughout our main campus. Demand for these services changes within the day, from day to day, and of course presently with the systemic changes that all physical workspaces are experiencing due to the COVID pandemic. The COVID pandemic has placed additional constraints on our system by ensuring appropriate capacity limitations and physical distancing to ensure that the health and safety of riders in vehicles is maintained. So first and foremost, our primary goal is to ensure the health and safety of riders, both during and post-pandemic, as we transition back to whatever form the in-person workplace takes. Our challenge is to ensure that the system is designed so that capacity aligns with demand in an economical way. We don't want a system that has buses that are too large or stops too frequently, and likewise, we do not want to have overcrowded buses and situations where passengers are waiting for an inordinate amount of time for transportation. So having a flexible and robust planning tool that can be used to better understand the impact of our design decisions, and as we plan for how individuals will return to the physical workspace, has been extremely valuable for planning these system changes. So lastly, in addition to serving the immediate campus, the system also serves other NIH facility clusters in the local vicinity, anywhere from 2 to 10 miles from the main campus location. These off-campus facilities are often located in lease facilities that were already in the process of being relocated pre-COVID. So a tool was needed to aid in planning for those changes. So since the COVID pandemic, of course, we've seen a dramatic impact on the physical NIH workspace and ridership patterns of the system. We know that these changes will continue well into 2021 and potentially have permanent impact on mass transit systems broadly. We felt that computer simulation modeling was uniquely suitable to planning for this wide range of what-ifs and potential scenarios that may occur in the future. We anticipated that this tool could be used to modify inputs such as demand and routes that do not exist today to understand the impact on system utilization and cost. We could experiment with a range of scenarios that considered different passenger arrival behavior and schedule delays. And then finally, having a believable 3D animation could help us communicate these changes to NIH decision makers. So here you can see the dramatic impact on daily ridership in our system pre and post-pandemic. So initially, ridership dropped to about 1/8 of pre-pandemic levels. And as the NIH has instituted a gradual return for some staff to the physical workspace, ridership today is about 1/4 of pre-pandemic levels. In addition, you can see that some routes were completely eliminated during this time. So now I will demonstrate briefly some of the features and capabilities of the model. For the main campus, we had a digital vector image of the building exteriors and road network from previous projects that we were able to utilize and build upon in this model. So metrics such as the number of passengers utilizing each route segment between stops are shown here in the interactive run and are tracked over the simulator run. Additional metrics such as the count of passengers that did not get on a bus due to maximum capacity already being reached, and passenger wait times by bus stop and passenger types are also tracked. So the model uses data for each route configuration, schedule, and demand maintained in a tabular format. In this rate, routes are easily reconfigured to test the impacts of these types of changes. Upon completion of a model replication, which in this case is 1 day, a variety of dashboards that show these key model metrics, such as utilization of the ride vehicles throughout the day, are included. So what were some of the key insights that were gained from using this approach and the analysis performed afterward? Well, we were able to immediately see the impact of these system design changes to the bus size, for example, or the schedule, and quantify the impact on cost and passenger proximity. We're able to apply a range of potential return to work conditions and see the impact that this had on system utilization and performance. It was very easy to see the impact of instituting capacity restrictions on vehicles and understand the level of demand, including demand variability, where those capacity restrictions are likely to be exceeded. In addition, this tool provided a context for discussion and brainstorming about a variety of potential what-if scenarios. The model was used to better understand what impact these changes would have and present decision makers with the information needed prior to implementing change in the real system. So in addition to a tabletop scenario planning exercise, the model provides a way to quantitatively assess the impact of these changes. For example, the NIH campus is served by a historically very popular station that is on the Washington, D.C. metro system. We know that presently and quite possibly for some time into the future that employees and visitors may not utilize that particular means of transportation and the shuttle connections that meet passengers at that station. We don't know what the impact will be, but we're able to experiment with a range of possibilities. Similarly, other scenarios were thought through in this fashion. So in summary, we found that this tool was extremely helpful in allowing us to test a variety of system design changes and a range of input demand possibilities under a climate of uncertainty. In addition to the quantitative output, we found that the visual nature of the simulation model was critical in communicating program staff and decision makers. This helped to build awareness of where potential problems and limitations exist in the current and proposed systems and help generate buy-in for change. Finally, this tool supported the programmatic goals that the shuttle system should ensure the health and safety of riders, meet the ridership needs of the NIH community, and ensure financial stewardship of this service. So thank you very much for your interest in our case study about how we utilize simulation to evaluate shuttle bus performance under passenger counts impacted by COVID-19. Please join us for the live Q&A session at the designated time in the Winter Sim 2020 program, and see the links here for more information about our contractor MOSIMTEC and the work we do in the Office of Research Services, Office of Quality Management at the NIH. Thank you and stay safe.